Hi, this is Dr. Roger Murphy, your FibroDoctor.com, author of Treating and Beating Fibromyalgia and Chronic Fatigue Syndrome. I want to share with you what causes fibromyalgia. There's a lot of debate out there, a lot of misinformation that fibromyalgia is due to, maybe due to being depressed, or maybe it's due to being a hypochondriac, or it's due to a virus or an autoimmune disease or something's attacking your body. Many different theories out there. The one that makes the most sense to me is that stress is the catalyst for the disease. And the reason why I say that is because after treating fibromyalgia for the last 20 years and looking at all these different theories, whether it's trauma, yeast overgrowth, chemical sensitivities, low thyroid, Lyme disease, neurological problems, Epstein-Barr virus, none of those stack up to when I do the testing and other doctors who practice like I do. What I've seen over the years is that stress is the catalyst for disease. Now, when people hear that, they think, oh, stress, well, everybody has stress. Well, that's true, but there's a big difference for those in the fibromyalgia community that have stress, because what we see is that many individuals with fibromyalgia, they had a difficult childhood. They were under a lot of stress as a childhood, and so they've lost the plasticity to stress as they get older. Maybe they were in an abusive family, maybe they, sexually or verbally abused, or maybe they had a very difficult childhood due to illnesses. But oftentimes, those with fibromyalgia can look back to their childhood to see that they lost their plasticity, their ability to rebound to stress that now has bothered them in the future. So I really do believe that stress is the catalyst for disease, and especially so for fibromyalgia. We look at several studies that have demonstrated how chronic stress undermines the normal hypothalamus pituitary adrenal, what we call the HP axis. Stress is the underlying catalyst for the onset of HPA axis dysfunction. And we know from surveys in the fibromyalgia community, it oftentimes people in the community will say that they can look back and they know that when they got under a period of stress, maybe chronic stress or maybe acute stress, something that came along right away, and it was the straw that broke the camel's back. But it could have been years of chronic stress, maybe a difficult marriage, a difficult work situation. It could have been illnesses, or it could have been something that came along right away, like the death of a loved one. It could have been from a surgery or an illness. But something comes along that's the straw that breaks the camel's back. And then what we see is that patients with fibromyalgia have depleted and bankrupted their stress coping savings account. So I like to use this analogy that we're all born with a stress coping savings account. And in our stress coping savings account, we have certain chemicals, certain vitamins, minerals, amino acids, essential fatty acids, hormones that allow us to be able to deal with stress. And all day long, we're under stress. Everybody's under stress. But for those in the fibromyalgia community, something comes along and it bankrupts their stress coping savings account so that they don't have the chemicals to allow them to be able to deal with stress, and then poor health starts to show up. The reason that occurs is because the hypothalamus gland, this gland in your brain, is your self-regulating robot. It helps to regulate the different systems in the body. It regulates your endocrine system or your thyroid glands, your sex hormones. It regulates your brain chemicals, serotonin, dopamine, norepinephrine. It regulates your stress coping hormones, the adrenal gland hormones, cortisol, DHEA. It affects your respiratory system. It regulates how high or how low your pain threshold is. So the hypothalamus gland regulates all these different systems: your blood pressure, your digestion, your skin temperature, your circadian rhythm, your sleep-wake cycle. Are you able to fall asleep? Are you able to stay asleep? Hunger, sex drive, body temperature, balance, coordination. You can see the numerous things that your hypothalamus is supposed to be regulating. But when the hypothalamus gets under too much stress, it starts to shut down. It's almost like in your house, if you have an electrical surge that you blow a fuse in your breaker box. Now, when that happens, everything starts to shut down. The electrical grid starts to go offline. And this sets up a vicious cycle for those with fibromyalgia. This stress does, and the fact that the body can't self-regulate itself because chronic stress, whether that's taking care of a special needs child or an elderly parent, or trying to make it through work when you have all the pain and low energy of fibromyalgia, or the stress of having an illness that people really don't understand. But stress disrupts this HPA axis, the ability of the hypothalamus, the pituitary, and your stress coping glands, the adrenal glands, to coordinate and to organize the different systems of the body correctly. When that happens, you start to get even more symptoms. When that happens, you get a thing called allodynia. Now, allodynia is low pain threshold. That's fibromyalgia. It's a central pain sensitivity syndrome where pain is magnified because your nerve cells is overstimulated. So stimulation, whether that's someone giving you a hug or shaking your hand, a tight blouse, whatever it is, the pain, the sensation, the stimulation is heightened so that it doesn't take much to initiate pain. The chronic pain disrupts your sleep. It's hard to go to sleep when you can't get comfortable, or you wake up in the middle of the night in pain and discomfort. It's hard to go back to sleep. This causes poor sleep, obviously. Poor sleep leads to fatigue, increased sensitivity. You have more pain. When you're not getting deep restorative sleep, you see your inflammatory chemicals go up by 40%, so you have more inflammation, more pain. This causes suppressed immune function. When you're not going into deep restorative sleep, your immune system starts to suffer. So now you might have chronic sinusitis, upper respiratory problems, or just feel run down and feel like you have the achy flu all the time. It lowers your metabolism. So it can compromise your thyroid. It certainly can compromise your ability to process foods correctly, which then slows down your digestion and can lead to reflux, bloating, gas, irritable bowel syndrome, constipation, loose bowel movements, and weight gain. Chronic poor sleep further depletes your brain chemical, your happy hormone, serotonin. When your serotonin level is low, you see that your pain threshold goes down. Pain is magnified. When your serotonin level is low, you're going to find that you're more likely to be anxious, more likely to have low moods, and more likely to have irritable bowel syndrome, and to have this thing called brain fog or fibro fog. We don't think clearly. So the hypothalamus pituitary gland, the HPA axis, that system really regulates all the other systems. But when it gets under too much stress, then it starts to initiate that the other systems start to falter. And that explains why with someone with fibromyalgia, you have so many daggum symptoms, right? You can't sleep, you have chronic pain, have low energy, have irritable bowel, restless leg syndrome, maybe chemical sensitivities, headaches. All these things come under the fibromyalgia banner. You know, it's a group of symptoms that people have in common. We call it fibromyalgia. And doctors often, when they see all this laundry list of symptoms, and then they look at you and you look normal and your blood work, according to them, is normal, they question, are you a hypochondriac? Are you just trying to get attention? Are you a drug seeker? It's terrible when they imply that. But it's because they don't understand that the body and all different systems are connected. In the conventional medical world, it's oftentimes about treating the individual specialty. So if you have a problem with pain, a lot of times you wind up at the pain doctor. If you have low moods, then you see a psychiatrist. If you have problems with your stomach, your digestive system, you go see a GI doctor. And before you know it, you're on the medical merry-go-round. You're seeing all these different doctors, and you're on all these different drugs. But what we need to realize, yes, absolutely, it's all connected. So I really believe, after doing this for 20 years and treating thousands of patients around the world, that the common denominator of fibromyalgia is a stress that comes along. Either it's a chronic stress or it's an acute stress that comes along, and it finally takes its toll on your body, and you just cannot recover from that. The first thing that goes is poor sleep. Once you start to see that you're not sleeping well, you see your inflammatory chemicals go up, your pain goes up, your energy goes down, your metabolism goes down, you're more likely to have low moods, anxiety, irritable bowel syndrome, restless leg syndrome, all things that come underneath this thing we call fibromyalgia starts to happen with poor sleep. And then from that, you start to see all these other things show up that, as they continue to be there, cause more and more conditions. You can't drug your way out of a poorly functioning autonomic nervous system. There's no way that you can take a drug for every symptom, although that is the treatment approach in conventional medicine. So stay tuned, because in the next video, I'm going to share with you who and why somebody gets fibromyalgia. That's very interesting. This is Dr. Roger Murphy, yourfibrodoctor.com, author of Treating and Beating Fibromyalgia and Chronic Fatigue Syndrome.